Under the Arrival tab, only include information that is relevant to the patient's condition or care. Do not waste time here as these fields are not mandatory. For example, you may only need to include others at scene if there are carers or guardians who have given specific instructions or who have been involved in the patient's care or extraction. If the patient's cousin is playing Xbox in the TV room, you don't need to record it. Under the On Examination tab, use the Quick button to acknowledge that there is no immediate life threat. If there is an immediate life threat, contact Esther through your radio immediately. Under Secondary Survey, select relevant signs and symptoms, and also include pertinent negatives, such as patient denies headache or patient denies nausea or pain. Record your findings in the initial assessment here without attempting to play doctor. For a medium acuity job, you will need to collect a set of vital signs every 15 minutes. Remember to record an SpO2 and cardiac rhythm where appropriate. You should also learn to use the quick keys where appropriate, but you should always use copy VSS and not copy all VSS, as this may record observations that you have not actually performed. Under the Management tab, select Management. Record management that you have initiated here, including drugs and reassurance provided. Do not use the sticky note here to record a story of how the patient was cared for or extracted from their residence. This information belongs in the case description. The RTA tab, or Road Traffic Accident tab, should only be used if you come across an accident while on shift and you are given permission to attend the scene by Esther. Complete the Billing tab as per a low acuity job. Now, select the Results tab. You will notice that because we have provided some management, even some reassurance, the Patient Not Treated field has been replaced with Patient Treated in green. Do not select a Patient Not Transported reason, unless you have not transported the patient. Even more importantly, do not select Patient Transported by Non-Emergency Crew. This is never a reasonable option. Ambulance Victoria has already pulled us up on crews using this workaround, so make sure you pass this on to your colleagues. Your final assessment should not often differ from your initial assessment. Under Transport, fill out the fields as you would for a low acuity PCR, ensuring that your loaded time is earlier than your transport code time. This is a common timecode error and occurs because VACIS knows that you cannot be transporting a patient to hospital if you have not loaded the patient into the ambulance yet. Include an observed outcome, and don't forget to include your kilometres for the job, from pickup to destination. You will then sign off on your job and then audit print as usual.